question on, can you hear me from those who are online? Can you hear me?
Yes, Prof.
I think so, but you should confirm.
Yes, Prof. We can hear you.
Hello. Nice to meet you again. Can you hear me?
Yes.
Who knows?
Yes,
You
Prof.
can't use the chat, but use the microphone.
Yes, yes.
You are talking to, we are not listening anyway.
Can you hear us?
Again?
Can you hear us?
Yes, now we can.
Okay, perfect.
Thanks. Oh, any question on the style lecture? Any problem or something that I think so? So we were at the point in which I was showing you a panoramic view of what are the reasons why government should intervene in the care system. And we have seen in particular some issues that we will afford on the next lecture. Principal of those are related to monopoly power of firms supplying care services and goods. Well, monopoly power is not dictated by technological condition, but it might also occur in situations in which the supply function is perfectly elastic and is compatible with a competitive system, given that the power of making price following the monopoly rule might be applied independent of the supply situation. Another reason is that of public goods that we will see in deep on the next lecture. Then that should not be confused though with the situation in which government decide to provide goods or services for care services. Another important issue is that related to externality. And finally, other issues that we considered are related to merit good or and not all, and buds, which are which originated from some kind of irrational on the consumer side, something that we will call a failure on the demand side. The final issue is that of incomplete market. Moreover, there are issues related to redistribution that we considered last time, and that which are not related to forms of market failure as traditionally considered, but they are in general originated by those situations in which the market outcomes in terms of distribution of income are such that they can signal that something didn't work. For instance, in all those cases in which we observe that in a given society there are a small number of people that are absolutely very rich and an enormous amount of people that are, say, below the threshold of poverty. this result signal that something hasn't worked, and it might be a good reason to intervene in order to redistribute income for different reasons that we will see. Now, given this panoramic, which are the forms? Another issue that we will consider is related to the forms of government intervention. They are related to how government can intervene in those situations in which there are clear market failures that do not allow the market to reach the competitive outcome that economists consider perfect. And I mentioned in this bit here, those instruments that some of the instruments that we can consider. One of those are the principal instrument that governments can use when intervening in the market in general and also in the market for health system, for healthcare provision, are commodity taxation and commodity subsidization. They are in a way two specular forms of government intervention that apply in all that can be used in all those cases in which a given outcome in terms of quantity or price is not reached. A given outcome that is considered the preferred one cannot be reached. For instance, one case, a specific case for taxes and subsidies. Wait a moment. Is that used for inoculation for vaccine. In those cases, not in the case of pandemic, but for instance, in all those cases in which, given the nature of the good supplied, inoculation is per se a private good, a pure private good, where it can be divided in units to be sold to consumers. It can be sold at a price. So per se, that kind of good is not public, non-rivalry and non-excludability work. Okay. And you might assume that in those systems, like the American one, apart from those situations like the pandemic, in which it was considered really important, also and the vaccination of the overall population was considered a public good per se. It can be sold to people that want to be protected by contagious infection. Now, what can happen if I sell the vaccine at a price that people have to buy in the market? Well, consider this situation, which is quite interesting and very often is can be found in those situations similar to the market. This is the quantity of vaccine of injection divided in units to be sold for people, and in the vertical axis I put the willingness to pay, the price. Now consider a standard demand curve from the potential patients that want to be vaccinated against flu, say, something that people are not obliged in principle to do, but they can buy normally in the market. And this is their demand, or also, as it often called it, is the marginal private benefits from vaccination against flu. Okay. marginal private benefit. Would assume now that S is the supply function, which is constant, very simple, which represents in this market the cost of production of any injection, okay, on average. Now, which is the equilibrium if it was the perfect competitive market? The equilibrium would be found in this point, let's call it E, where at a price equal to PE and the quantity QE of injection would be required in this market. Notice now that vaccination is per se a good that can produce external effect, because one wants to be everybody, not everybody, is a mistake. Someone might desire to be protected against a contagious disease and is willing to pay for it. But we have also a third-party effect of vaccination, because if the disease is contagious, it might the herd effect, sorry, the herd effect of vaccination might be considered important. For instance, assuming that in this society, the quantity Q star is considered the good, the preferred outcome for vaccination in order to get the herd effect in that society. So how can I reach, given the demand and supply function in this market, how can I reach the quantity Q star? But there are different ways for reaching that outcome. First, one is that of using subsidy, which means that government gives money to the producer in order to obtain a reduction of the supply function in a way that the equilibrium is reached. How can he do that? There are different ways to use the subsidies. We will use it even in different markets next week, I think. There are two ways I was saying. One is that called the type of subsidy called the specific subsidy. It means that government gives a given amount for each injection that the supply introduce in the market. For instance, I give €1 for each quantity, for each injection which is produced and introduced in the market. Which is the perception of this subsidy from the producer side? It is as if the producer perceives a reduction of the supply curve, a reduction of its cost of production. For instance, €1 makes the supply function perceived by the producer go to S minus, I call it S, where subsidy, the unit subsidy, which is €1 each, is the distance between the original supply curve and the new one. And this is €1. Okay. What happens with this effect? It happens that given that now the producer perceives a lower cost, which is paid by the government, it can supply that good at a lower price, and the equilibrium goes to, I call E star, which is the preferred outcome for the government. because it allows to reach the equilibrium Q star, which is the earth effect quantity that is makes the population in a safe position. Now, it is nevertheless, it is expensive. How much it costs? Is there anybody that see how much the government spends for paying the subsidy to the firm? You can see that in the figure. Look, the government gives €1 as to each firm producing injection. For each injection, I give you €1. Okay. So this is €1. How much it spends to reach the equilibrium E star? It must give, the government must give €1 for each injection introduced in the market. So the product of the quantity in equilibrium Q star, which is this distance, okay, times €1 as this is the amount of money that the government spends to make this society be vaccinated up to the point Q star. Is that clear? Hello? Even
Yes,
though
Prof.
at home.
Yeah.
So subsidization is a quite expensive way, but it might be useful in this form. The mirror instruments that government can use in this situation, which is very, in this specific context, very inefficient, is that of using taxation. What is taxation about? It means that government is taxing those who are not willing to pay for being vaccinated. Okay. And it means that, for instance, a government that wants to evaluate the marginal benefits, a marginal social benefits of vaccination, like this, like the green line. This is the marginal social benefits. In a way, makes those who are not willing to buy the good in question with a tax which is equal to €1 above the price. Okay. In so doing, is using what we call a specific tax. Excise tax, it's called technically, which makes the demand curve reaching the marginal social benefits that has been evaluated. In so doing, the government is inducing those who are not willing to pay to shift in this area up to a point that they will buy the desired amount Q star. Now, you can't possibly understand, but we will see it in deep. That is not a good policy under different that of taxation, of using taxation to convince those who are not willing to pay to accept vaccination. Why? It's not there are no ethical reason or any type of consideration of this kind. It is the reason is related to economic efficiency of the measure. First of all, when we are using taxation in this case, excise tax, which is called a specific tax, which makes consumer, in this case, pay a given amount for each quantity of the good consumed. The government must be aware that, first of all, taxation is the good instrument for government intervention only when government has to pay public expenditures. And using taxation for inducing behavior on people has never been a good practice, at least from an efficient point of view. Why? Because we will see that this sort of exercise, assume now that the prime ministers consider that taxation is a good way for inducing those who are not completed, are not fully convinced to be injected with the vaccine to pay this tax in order to be vaccinated. And they do pay the tax. And possibly they are vaccinated, or possibly they are not, we will see. But the point is that what happens in this context is that from an economic point of view, the introduction of tax induces in the market a kind of shock because it modifies the vector of equilibrium prices, such that assume that after having decided this measure, the government discovered that that measure was not necessary. So I am Mario Draghi. I decide that I want to tax an harmful good for any reason. And then I discovered that it was not so harmful, or that that tax was not necessary. Well, when I discovered this, I'm a good politician and say, well, I have taken money from people of my community. They were not necessary, or it was a bad idea, and I want to give back all the money that I put in my budget. I want to give this money back. What happens to the consumers? Well, the exercise is very impressive, because if I give back the money that I've really received after from taxation, I am not in the position of making that consumer to be at the same level of welfare that they were before taxation. Why? Because I have changed the vector of prices in equilibrium. And what consumers normally do is adjusting and, for instance, substituting the goods that are taxed with those that are not taxed. And in a market full of goods, it might be very likely. In so doing, the government, the revenues obtained by the government, is not able, even if it is given back to consumers, it's not able to put the consumer in the same position that they had before taxation. And this is very disappointing, because it means that government almost, not always, but in most cases, is not in the position of being neutral with the market. Why not always? Because as you can see in this picture that I have done, and in both cases of subsidy and taxes, the effect, the neutral effect, depends, at least in this picture, on the elasticity of the demand function, and possibly also on the elasticity of the supply function. And in particular, we will see that, for instance, for taxation, the most rigid is the demand, the more taxation might be optimal. And it works very well if I'm in the position of taxing those individuals who have a very rigid demand. curve, because in that case, the loss of efficiency is much lower. But in most of the cases, for normal good, it doesn't work. And this is the reason also why the use of these instruments for junk food, for instance, or cigarette or smoke, or for cigarette or alcohol or drugs or gaming, which are those goods considered bad for healthy problem, do not work properly. In particular, junk food, in the case of junk food, it was in all those countries that have tried to change consumers' behavior with the use of taxation. It was clear the failure, at least from the health side. Because, and in principle, the examples are very, very variegated, because when we talk about junk food, we have to decide what that means first. And junk food contains all those foods which are related to obesity. So it means that, for instance, the foods associated to calorie-dense food is something bad for health, or full of sugar, or full of fat. And why? Because they induce obesity, mainly in children, which is a serious problem in developed countries. And in particular, for instance, after the economic crisis of 2007 in the United States, the amount of children, which is a kind of addition that the family uses with children to keep them quiet. And it was a problem because the increase of obesity in that ages is very dangerous, because at a certain point they cannot go back. And so all the issues, all those problems related to blood pressure, cardiovascular disease and the like, start at an age which is very low with respect to the past, and which means also that when they are grown, the problem becomes very dangerous for the health system. Now, which are the remedies? For instance, one quite famous was that of the city of New York, where Bloomberg, who was the mayor at that time, decided a kind of measure that was taxing all the drinks containing a high percentage of sugar. Moreover, it's imposed to all the restaurant or similar categories, a kind of cap that could not be over, I don't remember exactly, because it should be 16 ounces of the sugared drinks to be consumed in public. It didn't work. It was in 2012, I think, and it didn't work in spite of the fact that a number of important cities followed this rule. Another kind of measure was in Denmark, who decided to introduce a measure taxing all food with a given amount of saturated fat over a given threshold, which I don't remember. There was a kind of shock for the population. Denmark is also a producer of, an important producer of milk, and all the food related to milk. And after 1 year, the government and people did not accept that, and it didn't work as a sort of constraint to the use of that food. So that after 1 year, the measure was withdrawn. because of the consensus of the government, was very much reduced by people. Another measure, which was very extensive because it involved food with a quite high amount of fat, sugar, what else? Salt, which is a cause of diabetics, was introduced in Hungary, and it was quite expensive for those people using that kind of food that was not considered healthy. The measure was not withdrawn, and for the simple reason that government had the need of making money from this kind of taxation. But it didn't work at all in terms of health, because Hungarian people did not change their food habits, and they didn't change their behavior because of the introduction of taxation. For instance, in this case, one measure that was used in the UK for food, junk food, is that of using a kind of advertisement or persuasion, so that, for instance, it seems that using the labeling with green light, in all those cases that food sold is considered healthy, is much more, it works much better than the case of using tax, or using the traffic light labeling, as it is called, when there is the red line for food which is considered dangerous, or yellow is so and so, is much better, works much better than taxation or the like. Nevertheless, just remind that Britain was one of the countries who, at least when I was students there, introduced a quite enormous tax on cigarettes, so that the purpose was that of discouraging students from smoking. And it was relatively bad, because what happens, and something similar occurred some years before against alcoholic. And even in those cases, which seem very specific good, cigarettes or alcohol are very specific. What people do in that case, after the introduction of a quite heavy taxation, is that of switching to substitute goods, which meant, for instance, in the case of alcohol, those suffering of this problem switched to drink almost everything having a certain amount of alcohol, independent of the fact that it was actually dangerous for it, much more dangerous than the drinkable alcohol. Because if you drink what is called, I don't remember the name in English, alcohol, ethylic alcohol, what we call in Italian alcol etilico denaturato, the pink one you possibly have seen at the supermarket. Well, it's something, it's alcohol ethylic, which is absolutely modified in order to make the smell or all the organoleptic quality of the alcohol very disgusting for people that try to drink it. But in England, they used to drink even that form, which unfortunately, I don't remember very well the name. They used to drink whatever you could find containing alcohol. Well, we will be back on it. And yesterday I was thinking that possibly one of the essay would be, one type of essay would be on BARTS, on economics of BARTS, and the effectiveness of instruments in combating this form of addiction of individual, mainly looking at the experience of governments that have tried to combat this form of consumption, irrational consumption by consumers with this standard form of instrument. I have to think yet about it, but we'll be back on it. Going back to the scheme, we have already talk about a bit about public provision, which consists on the decision of government of publicly provide or supply, it doesn't matter, a given good or services to the collectivity in the place of private supplier. And it can happen for a number of situations, and public provision is independent of the nature of the good. It's not necessarily related to the fact that good is public or not. And well, actually, as for the healthcare system, in most cases, it's not public. It's not a pure public good. That good which is publicly provided. Now, in the situation in which government have to decide which whether provide directly, or directly means that government itself becomes the firm producing the good, or indirectly, which means that, say, the Ministry of Health decide to buy goods and services from a private supplier, and anyway, the direct contact with patient or consumer is, whether from on the side of bureaucracy who enters in contact with potential patients or not, has to answer a number of questions that are quite important for government choice. The first question is what government should supply to people. I mean, the three questions are what, how, and who. What is related to the kind of good or services that government want to supply to the population. And the issue is not only related to the quantity of good that he wants to supply, for instance, for inducing people to consume a given amount of good. This is the case of all those interventions related to prevention, for instance. I want people to be prevented to having some disease, and I provide that to the population at reduced prices or for free, just because it's a good thing to do. But this is also, in most cases, is also related to standard goods or services that government might decide to provide independent of the overall system, because it's worrying for the quality of the good, which means that, for instance, all the market for medicines is, in this case, in Italy, for instance, is heavily regulated by the market with number of, by the state, with a number of control, because the nature of medicines is such that given that consumers cannot check the quality of a medicine that they are required to take, because you can exclude as an efficient policy that of imposing to consumers to make a chemical analysis of the aspirin that is required to take in order to see whether the principle the active principle contained in that pills is the right one. So for this reason, the government can ask the regulatory agency to control that market, and this is why it might want to intervene. But going back to our question, the intervention related to what kind of goods put together the issues of quantity of the good to be introduced and their quality as related to health. The second question is how provisions should occur in a given economy, because government can decide to directly intervene, I was telling you before, or even it can decide to delegate the power to others, and which are heavily regulated by government itself. Or in other cases, government can decide not to directly, not even indirectly provide a given good, but leave the provision of good to private firm, but introducing in the system those kind of authority in charge for controlling, for instance, the quality. This is the case in Italy, for instance, of the pharmaceutical industry. The government is not the indirect producer of the good, not even the direct producer. It can intervene with the pharmaceutical industry because it wants to finance research, as it occurred quite recently with the pandemic, the recent pandemic. But in principle, the pharmaceutical industry is composed by private firms, which are, however, heavily regulated by the government. And for instance, one important agency, regulatory agency well, now you should be expert, because after the pandemic, you already know all the kind of regulatory agency, but the most important is the Food and Drug Administration, which is absolutely important for the check of a new medicines introduced in the market. In Italy, each country has its corresponding agency. In Italy, it's called AIFA, which is Agenzia Italiana del Farmaco. Another one important is EIFA, EMA, European Medicines Agency, which helps government who doesn't want to enter into the market, neither directly nor indirectly, to control that in any case the quality of the medicines introduced in the market are those considered appropriate for the disease they declare to consider. And this issue is also related to the last question that I mentioned when government decide about public provision, which is who is expected to provide and in which form. And the question is related both to the financing of the firm, public or private, or controlled or not, and also to the distribution of services, because mainly in the health market, one problem, and it depends not on market condition, but in most cases also by the density of the population, the distribution of the population in the territory, might depend on the fact that there are, well, think of the United States. United States are a very variegated territory, So you pass from a city or metropolitan area which have quite high density of population to desert. And for health goods and services, you might want to reach all the population independent of their place in the territory. So who is in charge for financing and distribution is the question that must be considered. I think I was going to forget another important issue for health, where in both those economy, in those health system where with private or public are quite important, is the management of hospital. And for some situation that I mentioned yesterday, hospitals, both the small one and the very large hospital, like those supplying any kind of services for any kind of disease, which is not the case of small hospital, they are in a situation in which monopoly power might be exercised by those by the supplier, because for various reasons, population might be smaller, the demand might not be sufficient, and the cost might be much higher than the demand. And the management and the support of hospitals is something that government in both kind of public or private system considers. What else? Let me look. It was written already. I was going. Well, another thing that must be considered, is that very well known after the pandemic, is the action of government for public health considered as a whole. And the control of the epidemic condition of a country is generally done by government in both cases, either if the market for health is private, pure private, or even in those public systems. And you have seen with the pandemic what happened in the United States. It was not so effective as for the issue of vaccination, but given that the epidemic condition of the United States, which is in principle a private health system, required the public intervention, and for instance, vaccination was allowed for free to all the population, was supported and induced to be vaccinated against COVID SARS-2, as well as in those systems like Canada or Italy, where the system is completely public. And finally, as for, no, not finally, I'm forgetting a number of stories that I have to talk about. Another issue that must be considered as related to the instruments is that of redistribution. We mentioned this point yesterday, considering the case that, for instance, in a given country, we can find people below the poverty threshold that is considered the correct one in order to live a standard life in the country in which they are. And in principle, all the countries, either developed or not, have a level of income that over or below which also households must be considered poor or rich. In that case, and this is the income mostly affect the choice related to health. If the market were completely private, as you possibly know about the United States distribution of health, you possibly know that those who are not insured in the United States market for health do not receive the best cure that they could have obtained if they lived in a country like Canada or Italy, say. And but the same occurs also in those countries who has a complete public health system, because, for instance, the access to the market, to health, might not be so obvious for those people who are below the poverty threshold. Well, I just mentioned, now we will be back on this issue, but why I mentioned this? Because even in Italy, we have two different kinds of health goods and services, both provided by the public sector, but in different ways. One is that provided at the state level, and it is the same all over the country, which is that related to essential level of assistance, what we call the LEA in Italian. And this is directly determined by the Ministry of Health. Then there are, and it relates, it's not very updated, but because the standard was decided with the reform of 2001, so it's very an old one program, slightly modified in the last years, but anyway, that reform decided after a constitutional reform that gave all the power for production, provision, and financing to the Italian region, to a lower level government, I mean, it decided that anyway, the central level of assistance were something to be decided at a central level and should be equal for all the country. And that should be uniformly provided all over the country, independent of the fact that the region was rich or poor or with any problem. A second level of supply of health goods and services in Italy is still public, but it is at a lower level, at a federal one. Well, it's not properly at a regional one, which is not, Italy is not a federal state. But we have regional, we have less power of the government and provide each region differently from the other health goods and services, and decide also the way of financing that provision. For instance, I'm still resident in Tuscany, but I live in Lazio, and the difference between these two regions, which are very close to each other, by the way, are very high. For instance, as related to the financing that the region requires to people using some service or goods. For instance, Tuscany is making a program of financing goods and services, which is very heavily related to the income of the population. So if I were in a very high income level in Tuscany, I would spend for medicines or any kind of goods and services, even more that I would spend if I went to a private market and buy personally without the health system the same goods. Latium is using a different policy. for example, is still using for some services the modality of ticket. That is how we called it. But the tickets are almost the same for all those people that are requiring goods and services out of the essential level of assistance, which means that, for instance, if I want to buy a specific medicines under the Tuscan system, I go to the pharmacy and it is convenient for me to buy the market price of the medicine. In Latium, it is not, because I have a standard ticket which is equal for all those people which have the right to be assisted by the Latium system, and which is in general much, not so much, cheaper anyway than the market price. And anyway, apart from the way of financing, redistributive issues are also important as for the way in which government can intervene in the market, which are we will see this, we'll see all the effect of these policies also in the behavior of citizens. What the government can do if it found people below the poverty threshold in order to make them stay healthy or anyway have a kind of life which is the best, at least have a kind of dignity with respect to other people they deal with. You have an idea what government can do in presence of poverty or in presence of a relevant number of people below the poverty threshold, which means not only that they cannot consume expensive goods, but it means that also they might reduce the attention to health problem, to becoming also, they might become also a problem for the rest of the collectivity. So what is your idea about poverty intervention, government intervention against poverty? What government should do? Any idea? It's not a rhetoric question, it's also a question for those at home. Hello? What would you do? You are the Prime Minister of a country like Italy, which is considered in G8. So it is considered developed at a very good level of development, where a number of people are below the threshold of poverty. What should we do? Which means that, for instance, children don't go to school, or they do not receive essential assistance, in most cases because they don't know, they not have easy access to this facility or the like. What should you do?
We can let the richer pay for the poorer,
Oh,
maybe with taxes, or let them pay for some services more than.
well, I'm not asking you how to finance the intervention. You are talking about the kind of intervention for financing the needs of the population, but I am talking on something different, with which is related to how to intervene with them in order to make them to live at a different level. I want to reach them. Independent of the financing of the good. So assume that I have money. What should I do?
Increase government spending.
Speak up, because they are not listening, so you should shout here. Wait a moment, someone is asking something, but you should shout. Here. Yeah.
I couldn't understand in monetary matter wants to intervene to the poverty or what?
No, say it again. Did you understand the question?
In which terms we want to intervene to poverty?
No. It's not in which kind. I am the government, okay? And I know that in Italy, I'm not talking about underdeveloped countries or economies. We are rich enough. And, but I noticed that, we mentioned it before, even in Italy, which is a rich country in the world, G8, there is an amount of population, 2 digits now, which is below the threshold of poverty. Okay. Now, what government can do to eliminate this problem for the country, from the country? This
Right.
problem means, wait a moment, because here is not fully clear the question. These people below the poverty threshold, as in general, it is shown statistically that they have in general problem not only for living, just buying standard things for eating, drinking, and the like, but also problem of access to the standard service of a developed country, which is education, health, and the like. So government might want to intervene. Now, one before suggested to ask the rich people to pay for the service. This is a good point because I say it's a kind of Robin Hood policy. I bring money from the rich and pass them to the poor, and it might was, but this was not the question. The question, which is very delicate in this context, is that related to which kind of measure government should make in order not to solve poverty. I think it's almost impossible even in the rich country, but to do something at least. Which real action to reach exactly those persons who are in need. Someone from home was trying to... Hello? Sorry for
I was trying to say we can increase the government spending by transferring money to these kind of people.
Well, transferring money is a good measure. And it is not the only one anyway. Why? Well, it is we have a measure like this. Reddito di cittadinanza is called in Italian, which consists in giving money to people who are poor. So you are poor, I give you money, you are not longer poor. What is the point? Mainly in health, it might be a good measure after a so important economic crisis. I'm not talking about pandemic because it was introduced before with the previous economic crisis, which was compared to those of 1929, and where the number of poor and the population increased enormously. But what is the point or the problem in using transfer in cash, in money to the population? And what I'm going to say is even more problematic if I want to use transfer in cash for solving the problem from an health point of view. The point is that I give you money, you are poor, I give you money, but how do you spend that money? What has been shown, and it was a problem also during the discussion in Italy when the citizen income, reddito di cittadinanza, was introduced, that the money that are received by those who pretend to be poor, some are really such, but not all of them are really below the threshold, is that they can spend for everything they like. And the first time a measure like this was used in Europe was in England, in UK, actually, where even if you are absolutely able to reach poor households, you are never assured that, for instance, if you give money to a family with 3 children, it's not said that this money are used for making the overall condition of the family to improve, because it's very likely, it is shown quite often, that who is receiving the money uses that money for different goods or services, which are nothing to do with health condition, education, or the like. And if you think of the situation in which poor families are also those in which problems of alcohol or gaming or the like are quite spread, what happens is that you give money to someone who spends for something which is not good for the family. We will say this because it's also considered this way of this kind of action is often considered a quite bad way from an economic point of view for different reasons. But it's known in the literature, in public finance literature, as a kind of negative taxation, which means you fix a point where there is threshold for poverty. Those who are below this threshold pays a negative tax, which means they receive a subsidy. And those who are above threshold pay money to finance the measure of in favor of those below the poverty line. Another way to consider this problem is that of using what is called technically transferring in kind, which means that you don't give money directly to people in order to make them buy foods, medicines, pay fees for education of children or the like, but give them the possibility of using those specific goods for free. What I mean is that you don't give, if you were in any country, you have to pay fees for going at the university. One way is you give money for your, not children, if we talk about university, for the guys who want to go to the university, you can give money to the parents or to them and let them pay for the fees at the university. The other way is to give directly to the university the money and allow them to go at the university if they are not in the position of paying. And this is, or in other situations, if you suffer of those kind of diseases who are quite expensive to be cured, this is a very important problem even in Italy. Why? Because quite often that kind of disease, which are related to rare disease or not well-known disease, are also those who are very expensive to be cured. So what a collective should do in this case? Should they be free or not? The situation is quite embarrassing because people might say, well, I consider that AIDS is one of the most expensive, but it used to be, now it's less expensive, but it used to be one of the most expensive disease to be cured. First of all, because there is no vaccination which is able to work against HIV. And for this reason, the remedies, also for this reason, we have to use remedies which changes continuously. Now it's very well cured, but in the past, for instance, when they didn't work properly at a certain point, that kind of disease developed in a way that could be even a rare disease, never considered before, not very simple to be good and absolutely very expensive. Now, what to do in this situation? What should I do if I was the Minister of Health in situation where there are only few people that suffer of this disease? There are very few and expensive, and the solution is absolutely expensive. So that if you can compare 3 persons, are so expensive that you might have, I don't know, 3 places more in, how it is called, in intensive therapy of an hospital, that consider it is very expensive, because one day, and it costs about 3,000 euros a day, being one day there. So I can allow for 3 places more all over a year, against 3 places more in an hospital, versus 3 people with a serious illness that is absolutely expensive. What should I do? What would you do? Now, consider that the point in all the economies is that the source of financing are not unlimited. So, and in general, even mostly, no, not mostly, even in developed economy, the expenditure for health is very small for various reasons. Italy, for instance, which has a quite good system, which is anyway considered by one of the best systems in the world. Well, if I ask you the Italian, possibly, how many today are Italian? So what is your opinion of the Italian healthcare system? What is your face? As a question for the Italian students, what is your opinion of the National Health Service in Italy? Hello? Good, but sufficient, disastrous. Hello?
Good.
It's good. See,
Yeah.
I cannot read your name.
Giacomo.
Giacomo says that it is good. What do you think of the Italian system? Well, where are you from? Which region?
Rome. I'm from Lazio, Rome.
Lazio performance has been quite good. You wouldn't say the same if you came from Calabria. Is there anybody from Calabria here?
I'm from Sicily.
What about Sicily?
Well,
Calabria is much better. It's much worse than Sicily, for sure. It's the lowest level of any schedule. So,
in
what about
Sicily, the health system is barely sufficient, I guess, in many provinces. But overall, yeah, sufficient. Could be surely better. We
What
have
about the
a lack
others?
of personnel. We have a lack of new buildings, some facilities.
Well, but this is a good point for looking at the system, looking at building, a number of hospitals. And if you go in Calabria, they have a number of never used hospitals, which is enormous and very good. Apparently, unfortunately, they don't work. So this is not a good point, because what we the index for considering good a system is how it can respond to the needs of the population. So it means how many deaths you can find in the country, how many people infected in any case then are recovered and cured properly. These are the standards for saying that the system is good or bad. Well, of course, even the quality or the elegance or the aesthetic form of the hospital might be important, but the indexes that are interesting in terms of health are those related to health. How many people that go to any place of Italy are properly cured? So the Italian here, why don't they talk? Where are you from? Rome. Any other from a different region? Piemonte. What about Piemonte? Piemonte is good. Any else?
Yeah, I think the bad thing is only the waiting time for emergency.
No, you should speak up. Wait, I try to.
I think the only bad thing is the waiting time for emergency care.
Mainly with pandemic as a shame. The emergency is also a disaster.
I remember one
Do
time.
you live in Italy?
Yeah, I was there before I moved.
And how did you find, where are you from? Sorry, I forgot it from yesterday.
Ghana.
No, you are now in Ghana.
No, I'm not in Ghana.
No, Germany. No, sorry. Now you are in Germany now.
Yeah,
Good. So what is better, Germany or Italy?
Italy.
I thought. And what about Ghana? Hello? Bright, what about Ghana?
The healthcare in Ghana. Disastrous.
Well, you are, so you will be required to make it. How many are from countries from Africa here? You? No, you are Italian. No. Sorry, I'm very old. I forgot. If you change a place, yesterday there was an Italian there, so so you must be Italian. Otherwise, I'm confused. You are from Uganda. What about Uganda? It's okay. So anyway, we started from a question, which is the kind of choice, the correct choice for public system to be taken in any case, because this is a kind of decision to be taken. So if I have, and I also, I am the government as usual. I am the government and all governments have problem with spending. So the amount of money is never enough. And possibly also because it's not perfectly used, but this is a different issue. Money are not enough. I have to make a choice. What should I choose? Offering the whole population something which is important. We have seen how important was intensive therapy inside the hospitals, or taking care of those people who are very expensive disease. Yes, sure. Shout. Speak up, otherwise people at home cannot listen.
If I want to do something in this,
No. I have to explain something. I'm very old and a bit deaf. Now, with the mask, I cannot follow the mouth. No, which means that you have to shout or speak up anytime that you want to say something, otherwise I cannot. So now she's shouting.
if I wanted to do anything in this case, I would transfer the money to the agents like hospitals. The hospitals allocate for the physicians allocate this money to those patients with rare disease. And this could fit surveillance and with more strict observation of money to them, allocating money to them. One of the, in my opinion, one of the way is that to allocating resources to the agents.
I'm not sure it's not fully clear to me your decision, but there are some situations which you have to choose. You are trying to mediating, there's a kind of mediation of the worst situation in which people are going to die in the absence of cure, and the good position for all the rest of the remaining. This is your position. The choice you were required to take was that of choosing between spending money. You have needs now. There are a small group of people which is in danger, very small, and they required something. And there is a standard needs for the community, which is now, I mentioned intensive therapy because it was quite important during the pandemic, that you can choose to spend for, and it benefits all the population. What would you choose? This is the kind. Because if you were rational, the question is not so obvious, because you might be tempted to answer with different, under different influences, or considering something. But if you are rational consumers, like those that we imagine in the market, you would say, look, if they die, we save a certain big amount of money that we can save. We have the possibility of saving a high number of, or making better of a quite high number of people in the rest of the population. So a rational agent using the market rationality should prefer to let them to die and spend the money with something different. If your reasoning follow the standard welfare maximization, because if you transform all the kind of utility money and then you maximize, this should be the result, because you are obtaining a much high number of people happy with the other measure with respect to those very expensive, that there is no choice, there is no race between the two. But you can also decide to refer to something different in this context, which is why also public system should intervene. And we are going to close the lecture. How intervene in this case? With the distribution in kind, which is considered the best. I don't give money to those suffering a serious illness, but I allow them to receive the cure, considering that we are, where are you from?
I'm from Iran, but I'm thinking about it.
You are from Iran, and Iran is not a fully democratic country according to the, no, it's not a critic, just as well known.
I'm thinking maybe those measure, majority of population, maybe government can decide for them, but about the other patient with rare disease, maybe NGOs or donors can help to solve the problem. Private market, private.
How is the health system in Iran? How is the health system in Iran? Do you buy an insurance in the market? Everybody is like American?
Different kind of public insurance and private insurance. Maybe it's a combination of that. And if you're rich, you can buy
Why did I put the finger in a very embarrassing situation. Why did I say that democratic country or not makes a difference, even in health? A democratic country is that which is based on constitution. And constitution contains the number of rights that people in that country have the right to perceive. And in our constitution, as well as in American, French, or the like, one right is related to health. And if you want to guarantee the health to everybody, which is everybody who is equal to all the other, independent of any economic consideration, you would never decide that those whose expenditure who requires expensive assistance should not be considered by the public system. And this is the basic of the democracy. It's not the market. It's not the fact that we have a market, the capitalism form of market. Look, the theory in this respect says that a perfect planner, like you can think of the Soviet Union during the communists. The planner decided all the expenditure of the population. The needs were decided by the planner, and people were allowed to consume only what the planner decided. It theoretically reaches exactly the same result, as good as perfect competition, if the rules, the assumption are respected. So it's not a point with the economic system. The point is with democracy. And democracy guarantees the right, which are not guaranteed in a system which is not democratic. Because if you put all the people are at the same rights, you would never say that it's not convenient to support those who are poor or who are expensive. This makes the difference. It's not a problem with capitalism or anything else.
I would say that in my country, in this situation.
Anyway, there is a market in Iran.
Pardon?
There is a quite standard market in Iran.
Yeah, of course.
Of
But
course.
in this case, the government don't intervene to solve the problem for patients with rare disease or chronic disease. Mostly the private section.
Does the government intervene in case of poverty? Is there any measure for combat people living below the poverty threshold?
Unfortunately, maybe they come, but in reality, there isn't anything that make people under the line of the poverty. But in case of rare disease, I mean, just the private section, mostly the pharmaceutical companies solve this problem, or NGOs solve this problem.
Do you have an idea of money? How many poor people?
How many poor?
Ah.
I think maybe in this situation, if I, frankly speaking, maybe more than 60% of
60, you said?
yeah,
Oh my God.
60% of people in Iran are under the line.
What about Uganda?
Most people poor, they are broke.
Most means
Maybe they are on the reason like 10% or 10%.
what about the other countries? Who knows? Bright from Ghana, now in Germany. What about your country? Bright Badu is sleeping. Bright Badu is sleeping now. What about Sheima Lavey? She is sleeping also.
She's from my country.
Iran again.
I'm Iranian again.
Bright, what are you doing now? Veronica Nazarova from. Veronica is sleeping. Veronica is sleeping. Altina Zamirova, sleeping again.
Prof, can you please repeat your question? I'm here.
Where are you from?
I'm from Russia.
Russia, good. So what about your country assistance to poor people?